most honest, kind horse in the world was turning to us every time we put the saddle on and said, please don't hurt me. So 85% of our horses that present for gastric disease are presenting for a behavioral presentation, undesirable behavior. We think about gastrointestinal disease, ulcers, sand, IBD. We think about musculoskeletal disease. We think about dental disease. But we have to think about these horses as behavioral as well. And this goes back to George. So George was the most honest, kind, trustworthy horse you could ever hope to own. When we got George, he'd an ex-race horse. We used to saddle him up, and every time we would saddle him up, he'd turn around and try and bite us. And we would do what we were taught to do, which is push George away and say, stop that, George, stop biting us. We knew George didn't have ulcers. We checked him. We didn't see any evidence of lameness. We thought he was healthy and fit. And we even said, that's just something he has learnt to do. It's just a learnt behavior. We don't have to worry about it. But we never stopped to think about it from George's perspective. We never stopped to ask, what was George saying? The most honest, kind horse in the world was turning to us every time we put the saddle on and said, please don't hurt me. Please don't hurt me. We know that horses with lameness will form anticipatory behavior that's shown during tacking up and girthing. So they form the connection between pain that's coming and what we're doing in terms of saddling. And I still feel really guilty about this, that I didn't have the awareness to connect the dots, that we need to actually look at this from George's perspective, and we needed to reshape his perception of what was going on far less than our perception of what was going on. And so we need to reshape that behavioral association. It's one of the reasons why we see that behavioral responses don't always mimic treatment responses like these studies down there. We need to think about how we retrain the horse. We need to think about reshaping behavior. We need to recognize that pain reduces cognitive capacity. It's hard to learn when you're in pain or when you're anticipating pain. So they will not learn as fast as they did before they had a painful event. This is whether it be lameness, this is whether it be gastric disease, anything that's chronic pain.